Dry needling and manual therapy. There's a certain individual who has a very popular Twitter following. He's a very intelligent individual. This is not a criticism of him as a person at all, in no way, shape, or form. In fact, I would never want to debate him. He would kick my ass because um, if you know your shit going into a debate, you can look like you're right, even if the other person has a good point. It doesn't matter. There's a lot to a debate besides just simply being factually correct. Um, Sometimes it's knowing your shit. If the other person doesn't know some fact, they don't have a counterpoint. So, if you get into a debate with someone and they really know the topic, they can make you look like an idiot, even if you're right. But this person is probably correct in most ways, and like I said, I have no interest in debating this person ever, because they would make me look like a jackass. However, I am going to give my opinion on the literature that is available. So that's the part that I'm going to focus on rather than trying to counterpoint someone. So first off, let's hit dry needling. That's the first one. What caught my attention was this person making a post about manual therapy sucks. And that probably just gave away who it is. And like I said, this person is way more intelligent than I am. So there's no way that I'm going to even disagree with them on the fundamentals of this. But I am going to say, looking at the research, this is something I find interesting. And it made me think of dry needling. Dry needling doesn't work. You can see that. Look through the research. Every single time dry needling fails. In fact, if you guys are familiar with what's Cochrane reviews, they're basically the gold standard. If you're in the medical field or you do medical research, you know exactly what this is. If you're not, then I'm going to tell you that these are basically the gold standard. Like, it is the highest level of evidence. If there is a Cochrane review on something, it's basically like, this is what we know to be the most accurate information available. Does it mean it's right? Not necessarily. It's just the most accurate information that we have available. That doesn't mean more research can come out in the future and tell you that you're completely wrong. I mean, that's the reality of research. Something new can come out and tell you, oh, everything you thought you knew for all this time was incorrect. Just like how there's actually an exception to the laws of thermodynamics. For a long time, we thought there wasn't. Turns out there is. Uh, Neurogenesis in the brain. For a long time, we thought that you didn't make new neurons and glial cells in the brain. Your brain forms at a certain point and then it's done, and you can only lose cells from that point. And now we know that, turns out, actually, yes, you can. But at the time that we believed that, it's because the technology we have didn't allow us to see really small changes. Now we have these incredible MRI machines with, 7 Tesla magnets, even bigger, and we can see really fine details in the brain so we can measure these things. So, why does dry needling suck? Well, you look at the studies, and there are studies where it works, and then there are studies where it doesn't work. And if you look through the research and you pull it all together and you compile everything that's available, you'll see that the majority of studies say that it doesn't work. Okay. Cochrane Review covered this. And Cochrane Review also says that acupuncture works. Acupuncture works. Now, I can tell you from my own personal experience, I've had good acupuncture that worked, and I've had acupuncture that didn't do anything. In fact, actually, I'm in a study. I participated in a study for a condition known as choroidoconjunctivitis. It's a really nasty thing if you ever have to deal with it. It's an eye condition. And Dr. Deepinder Dhaliwal, you guys can find this study at the University of Pittsburgh Medical Center, did a study using acupuncture to treat choroidoconjunctivitis. Now, I'm just going to tell you what happened. Whether or not you guys think this is the mechanism, maybe it's placebo effect, that's totally fine. Doesn't matter. The point is, we measured my tear production, and I had barely any tear production, and my eyes were constantly dry, and I was in constant pain. We did 2 treatments of acupuncture, and then we remeasured, and my tear production in my eyes was normal. It fixed it. And her study will show you that this worked for not just me, but for all the other patients as well. Uh, Acupuncture worked, and it resolved their choroidoconjunctivitis. Similarly, I had a back injury one time. I pulled some muscle or something like that in my back. I can't even tell you what was wrong because I had MRI and I had a CT scan. They couldn't find anything, but I'm like, dude, I'm telling you, my back hurts. I know it hurts. Yep, there's no damage on the MRI. There's no disc damage. There's no vertebral, fracture or something like that. But I just knew I had pain. I got a name and a number. I went to this little Chinese woman who might have weighed 80 pounds, and I was, going to her for treatment, and she was going to do some like soft tissue massage type stuff. And in the process of us talking, she was like, "Have you tried acupuncture?" And I'm like, "No, like I haven't tried acupuncture for this. I don't know that it would necessarily be of any benefit because I think it's a muscle pull. So I just figured she would put some kind of, I don't know, oil or whatever on it and then try to rub that into it. Traditional Chinese medicine, right?" Um, and she's like, "Well, let's try acupuncture first before I start, trying like massage work and stuff." And she put these acupuncture needles in my back, and I was like, "This is weird, but pain's gone, like completely gone." Now, did it just block the pain sensation? Probably. Like, I'm not saying like, oh, it healed the muscle, but boy, it blocked whatever pain I was having. That was pretty impressive. And then other times I've had acupuncture for other things, and it didn't do anything. I've seen acupuncturists where they stuck a whole bunch of needles into something and it didn't do anything. I've had dry needling done by physical therapists, and I've had dry needling done by an orthopedic surgeon. So this is weird, and this is important for you guys to stop and pay attention to. Cochrane Review says that dry needling doesn't work, and yet Cochrane Review also says that acupuncture works. And so what this tells me, as a person who, you know, is just a consumer of medical treatments, it really matters where you put the needle. That's the way I look at it. It matters where you put the needle. Even the fact that there are studies where dry needling worked and then there are studies where dry needling didn't work, what I suspect is happening there is it really matters that you know where to put the needle. I think the same is true of acupuncture. I think that there are good acupuncturists who know exactly where to put it, and there are bad acupuncturists who don't know exactly where to put it. And I think that makes the difference. I genuinely think that makes the difference. And I say this because I'm going to move into manual therapy. There is an individual who I think extremely highly of. His name is David Lasondak. He even wrote a book on this, but that was years later. Now, I saw David after I had been in a car accident. Yeah, I was in a very serious car accident, and I had extreme pain in my neck, shoulders, etc. My head had been thrown, and so I had like this terrible whiplash injury, and I had a concussion and all this wonderful stuff that came with it, right? And David did something called structural integration, which is basically it's like rolfing. It's a soft tissue work. If you would have seen me when I first came in, I had like forward head carriage and I was hyperkyphotic, which means that my thoracic spine was overly rounded. My shoulders were sitting forward. I had this terrible looking posture where I was almost like, well, my body was in this weird stretched forward state. As I saw David week after week and he worked on me, my posture completely changed, and suddenly my head went backwards and my shoulders went back to normal and my hyperkyphosis resolved. My pain went away, and I looked like my old self as far as my posture was concerned. David really worked hard. He did. I have to say, like, I don't even know how he could do it. He would keep digging into the muscle and keep that pressure going for like a whole hour, which he had to dig deep into the muscle. This isn't like feel-good massage where someone just kind of like, oh, let me just rub your back a little. This was like him taking his finger and like jamming it into a single muscle and then just creating a ton of force and pressure in very specific spots. This isn't like I take my whole hand and rub across like your entire shoulder, like let me relax your shoulders. It was like, oh, here, your scalene is tight. I'm going to take my finger and jam it into your scalene and push down as hard as I can and manipulate it until that scalene releases. This is probably something to do with the Golgi apparatus and all that kind of stuff like that. There's probably some neurological CNS type feedback loop that's way beyond my understanding. The point is that oh, you can't tear fascia, you can't stretch fascia. You don't have to tear or stretch the fascia, duh. all you have to do is get the muscle to turn off. It's a neurological thing. It's like people think they have tight hamstrings, but if I put you under anesthesia, you don't have tight hamstrings. I could take your leg and lift it all the way to your face. The reason your hamstring is tight is not because the hamstring is tight. The reason your hamstring is tight is because your nervous system is telling that muscle to stay partially contracted. Your nervous system is making that muscle tight, not because the muscle itself is tight. It's not like you need to lengthen your hamstring. What you need is for your nervous system to say, let go of this damn thing. Okay? That being said, I had David work on me. That's manual therapy. And it was life-changing. Oh, just like the headaches improved, the neck pain improved, the back pain improved, my posture improved. I used to feel like I couldn't breathe. It was like I had a corset on or something. My ribs were so tight, due to that back issue, right? The hyperkyphosis, the muscles in my back were so tight that I had a hard time taking a deep breath. You can't expand your rib cage. Man, when he worked on my rib cage and finally got those muscles to let go, it was like someone took this corset, this invisible corset off of me, and I could breathe again. So grateful. So grateful. So, what does this have to do with dry needling and acupuncture? Well, just like dry needling and acupuncture, it matters where you put the needle. You need to know where to put the needle. When it comes to manual therapy, I don't disagree with this individual who's, posting a tweet that manual therapy sucks. Manual therapy does suck. I've seen tons of massage therapists and had no benefit whatsoever. In fact, if you stop and think about it, for the number of massage therapists I've seen, 2 of them were good. And I've had a lot of massage work. And 2 of them were good. So obviously the majority of them were not. That being said, similar to how acupuncture, you need to know where to put the needle. Yeah. So I'm going to say the same thing is probably true for manual therapy. You need to know exactly where to push. If you know where to push and you know how to push, that makes all the difference. It really does. And so that's my counter argument. It's not much of a counter argument because obviously the research is the research, and the research says it doesn't work, and that's true. Odds are if you go get manual therapy, it won't be beneficial. Just like how odds are if you go get dry needling, it probably won't be beneficial. But that isn't to say that it can't be, because it's entirely possible that you see a practitioner who knows exactly where to put that needle, and so dry needling is beneficial for you. And it's entirely possible that you see a practitioner who knows exactly where to push on that muscle, and so it is beneficial for you. And that makes the difference. It isn't just putting needles in or just pushing on people. It's knowing exactly where to push. That's why you pay them. It's kind of like with coaching. You're not paying someone to count your reps. You might be. I hope you're not. You're not paying your coach to sit there and count your reps. In fact, you're actually not even paying him to write you a program. That's not the point. Now, I could write you a program anytime you want. I'll just randomly pick some sets and reps and tell you to increase the weight. If you want to have an actual coach knows when to increase. An actual coach knows when to decrease. They know when to pull back. A good coach knows. I don't want to say it's I hate saying it's an art, but it is a little bit of an art. It isn't just a math equation. It's like you can watch an athlete move and you're like, ooh, that is a really bad grinding rep. He's got to be 1 away from failure. Set's done. And you know when to step in. It's like I don't know. You just develop it over time. You can tell. You can tell watching an athlete. When you watch them move, you can tell, oh, nope, he's moving slow today. He's just under-recovered. Oh, that 3rd rep. We're done. Set's over. I know, we were supposed to do 5, but you're moving too slow on that 3rd rep, so set's over. There's something to it, and it's very hard to quantify it because every athlete is different. So I watch one athlete run, and I'm like, wow, he's running great today. Another athlete runs faster than him, and still I know for that athlete, they're not at their best. And so I can see it and recognize it. I can say to them, hey, you're cooked. Take the day off. There's an art to these things, but there's also a science to it. Maybe it's just hard to quantify some of these variables. You develop a sense of them. I like to compare it to music. I spent years learning all my scales. I know all the modes. How many people even know what a mode is? My dad was a fantastic musician, probably the best musician you've never heard of. He, my dad was just an amazing individual. Everyone, everyone that knows my dad knows that he was just a phenomenal musician. Trumpet, piano, guitar, flute. Uh, it doesn't matter. He picked it up and played anything, and he was good at everything. Everything. Like, I don't think there was an instrument that he couldn't play. I mean, shit. One time he picked up a banjo and just started playing it. I was like, oh, it's a lot like a guitar. What else was there? Violin. I remember we went to Volkwine's music shop. He bought a violin, and it was like, have you ever even played violin? My dad's like, no. My dad sat down and played violin. And he's like, well, it's not all that different than a guitar. It just doesn't have frets. And it was like, did someone teach you how to play? No. I just watched enough people do it that I just figured it's similar to a guitar. Okay. I don't have that talent, unfortunately. But regardless, the point is, I learned all these scales, learned all these chords, learned all these modes, learned all this music theory and stuff like that. And then at some point, you just have to sit down and play. Like, I can't write a song for you by sitting down and being like, well, 1, 4, and 5 are your majors, and so we'll do this, and then we'll do, like, you could write by number if you wanted to. I mean, like, from a literal standpoint, yes, I could just take a chord progression, write it down for you, and I know that would sound fine because I stay within the key. And so therefore, here's my majors, here's my minors, here's the diminished, like, these chords go together. But, like, I can't write you Stairway to Heaven that way. Like, I can't sit down and be like, oh, I'm going to put this together and Bohemian Rhapsody is going to come out. There's an art to it. That art still has to follow rules. It still follows the science, if you will, of music theory. But there's an art to putting these things together. And so I think that that's where there's this shift. It's like there's an art to acupuncture. There's an art to dry needling, for that matter, because you have to know where to put the needle. When it comes to manual therapy, there's an art to it. You have to kind of figure out and know where to push. And maybe that's something that can only be developed with experience. I don't know. I don't know enough about it. I don't do manual therapy. I don't do acupuncture. I don't do dry needling. I don't do these things. But what I can say is that as someone who has been on the receiving end of medical treatments, definitely. I've had acupuncture that was really, really effective. I've had acupuncture that did nothing. I've had dry needling that was effective. I've had dry needling that did nothing. I've had manual therapy that was extremely effective. And I've had I've had manual therapy where I was just like, no, I don't feel any better afterwards. So that's my 2 cents on it. Rather than rule things out and be like, dry needling doesn't work. Acupuncture doesn't work. Manual therapy doesn't work. Manual therapy sucks. I err on the side of it really matters at the practitioner. I really think that that's where the big difference is. I think it matters who's doing it, their level of ability, their level of experience. And I think that that is the major factor that you have to stop and consider. It's not just pushing on a muscle, it's knowing where to push. So I gave you guys the analogies of coaching, knowing when to push and when to pull back, and I gave you the example of music, right? You can know all the theory behind music, but come on. Jimi Hendrix is Jimi Hendrix, and he broke lots of rules. In fact, Jimi Hendrix is a terrible guitarist. Did you know he used his thumb? Yeah, watch him. He will use his thumb when he does bar chords, if you can find old videos. You're not supposed to do that. It doesn't make any difference, obviously. It certainly didn't ruin the sound. But you're not supposed to do that. It's not technically correct. Yeah. Well, whatever. There's lots of things that are not technically correct, and yet they work. They sound great. Look at Jimmy Page. There's another one who, oh, well, this thing he does isn't technically correct. Who gives a shit? It's Jimmy fucking Page. Jimmy and Jimmy. Jimi Hendrix, Jimmy Page. Anyways, look at Paul McCartney. Let's just take a different one. Paul McCartney playing the bass. He would change a chord by simply just changing the bass note. Oh, wow. People make fun of the Beatles. They're like, Beatles were overrated. It's like, no, you don't understand. Paul McCartney, phenomenal musician. You just don't understand what you're hearing. If it wasn't for the Beatles, you wouldn't have A Day in the Life. And if it wasn't for A Day in the Life, you wouldn't have Bohemian Rhapsody. You wouldn't have Stairway to Heaven. Other artists were inspired because of A Day in the Life. People don't realize that. That's something important. Anyways, off on a tangent here. But I think you get my point, is that there's a science to things and there's an art on the other side of it. And sometimes that art is what makes the difference in whether or not something sounds good or works good. And not all things can be quantified quite so easily. If you guys like the video, like the video. If you have experiences with this stuff yourself, comment below. Maybe you have had dry needling and it worked, or maybe it didn't work. Maybe you've had good experiences with acupuncture or manual therapy. Comment below. Share your story. We'll talk about it. Maybe it'll help someone else. In fact, that's a really good reason for you to share it. If you have something that you think will help someone else, please comment it below. Because that's what this whole channel is entirely about, is helping other people. That's why it's not monetized. That's why I don't sell anything. The whole channel is entirely focused on I want to help other people. And if you like helping other people and you want help or whatever capacity you like this philosophy of paying things forward, subscribe and we'll continue this kind of discussion. We can talk about these things, and in the future I will continue to just kind of talk about topics that people are polarized on things, and oftentimes the truth, the answer, the solution lays somewhere in the middle. And that's why I like to talk about this stuff. That's why my videos aren't 1 minute long. I like talking about the stuff that doesn't have a clear-cut answer, especially whenever I can't answer it, because I can't tell you why this works. I don't know why manual therapy works. I just know that I've had manual therapy where it really helped. Same thing for acupuncture. I don't know why it worked, but I can tell you that it worked. Some things in life just work that way. I have no idea why. We can talk about winemaking sometime. I don't know why, but sometimes certain wines come out really well. There's some chemistry in there, but there's definitely some art to it as well. Love you guys. Thanks so much for your time, and I hope this helps even just one person.